for that to happen. Okay, we are recording. And just some initial housekeeping. We've set up both American Sign Language and Spanish interpretation translation services today. So our ASL interpreters are Jessica Gomez. Thank you very much for joining us. And then Ruth the Jesus will be joining afterwards. They'll be both spotlighted on your screen, as you can see, doing simultaneous translation. I also want to welcome Isabelle Escobedo from the Colorado Language Cooperative, who will explain how Spanish translation will work. And that'll be an icon that looks like a world at the bottom of your screen. So Gisela.
I have to unmute her. Give me 1 second.
Okay. We're going to unmute our interpreter, who will explain how Spanish translation works.
Thank you very much. Hello, everyone. My name is Isabelle Escobedo, and I'm here with the Community Language Co-op, and we're here to help create a space for language justice. What that means is that we want to create a space where everyone can participate and engage in the language of their heart or the language that they feel most comfortable in. We will use simultaneous interpretation to create this space. So when I finish saying this in Spanish, we will turn on interpretation, and you will see a globe icon on the bottom of your bar that says interpretation. If you have a phone or a tablet, it has 3 dots that says more. So if you're not fully bilingual, I ask that you select your preferred language. And if you're bilingual, just feel free to listen in everyone in your language. You can also mute original audio so you don't hear both languages at the same time. Hola, buenos días. Mi nombre es Gisela Escobedo y estoy aquí con la Community Language Co-op. Y estamos aquí para ayudar a crear un espacio donde practicamos la justicia del lenguaje. Lo que esto significa es que queremos crear un espacio donde todos pueden participar e involucrarse en el idioma de su corazón o en el idioma en el que se sienten más cómodos. Vamos a usar la interpretación simultánea para crear este espacio. Así que cuando termine de decir esto, van a activar interpretación y usted verá un icono de globo en la barra pantalla de abajo de su pantalla donde dice interpretación y vas a seleccionar tu idioma preferido si no eres bilingüe. Y si eres bilingüe, pues puedes escuchar a todos en su idioma. También te recomiendo que silencies el audio original para que no escuches ambos idiomas al mismo tiempo. Muchas gracias. Thank you very much. You can go ahead and turn on interpretation.
Okay. I think we are all set with the technicality. So hello and welcome everyone. My name is Alexandra Scranton. I'm the Director of Science and Research for Women's Voices for the Earth, and I'm the moderator for our panel today. Welcome to our first annual Vaginal Health Week panel. We are so pleased to have a great turnout for this first time we've tried an event like this, and we're really glad that there's been a lot of interest in the topic. For those of you new to Women's Voices for the Earth, or WVE, as we often call ourselves, WVE was founded over 25 years ago with the mission to amplify women's voices to eliminate the toxic chemicals that harm our health and communities. We work primarily on toxic chemical exposures from products such as cleaners, beauty and salon products, and most relevant to today's topic, intimate care products, which is what we call our Detox the Box campaign. Just a note on terminology, we do use the word intimate care rather than feminine care, which is the term more often used by the industry. This is to reflect a more inclusive approach, recognizing that there are people with vaginas who don't identify as women. So our Detox the Box campaign began in 2013 with a report called Chem Fatale. And this was really the first report to focus on and examine potential chemical exposures through the vaginal route. And what we realized quite quickly with this campaign was both just seeing the lack of attention and certainly the lack of research on vaginal health overall, and especially on the impact that vaginal chemical exposures can play. And our concerns were intensified when we looked specifically at exposures to people of color. And when we've long felt that these topics needed greater awareness, greater attention, more discussion, more research. So we're really excited to have developed our first Vaginal Health Week to uplift these concerns and launch some of these really needed, important discussions with all of you. So thank you to all of you for joining us in this effort. We are so pleased today to have 4 outstanding panelists join us today, and I'll briefly introduce them, but also encourage you to take a look at their full bios on our website, which is www.womensvoices.org/Vaginal Health Week. And we'll put that link in the chat so you can access their fuller bios. In no particular order, I will start with Dr. Ami Zota. Dr. Ami Zota is an associate professor at the Department of Environmental and Occupational Health at the George Washington University Milken Institute of School of Public Health. She directs the ARISE EJ lab at George Washington, whose mission is to secure environmental justice and improve health equity through advancements in science, policy, clinical practice, and communication. And she has published several papers on chemicals in intimate care products and their effect on our health. So welcome, Ami.
Thank you. It's nice to be here.
Great. Next is Dr. Ebere Azumah. Dr. Ebere Azumah is an OBGYN and a co-founder and board president of Love Your Menses, a nonprofit organization that provides a platform for girls and young women of color to become more aware of their bodies and to embrace the transition from pre-puberty into puberty. Dr. Azumah and Love Your Menses are committed to breaking the period taboo in Black and Brown communities through evidence-based education, resource connection, and mentorship. Welcome, Ebere.
Thank you so much. It's a pleasure being here. Thank you.
Next up is Dr. Astrid Williams. Dr. Astrid Williams is the Environmental Justice and Reproductive Health Manager for Black Women for Wellness. Dr. Williams coordinates the Sisters in Control program, which spans environmental justice programs and healthy hair initiatives that are centered around health equity while creating a space that allows consumers, hair care, and beauty professionals and social advocates to talk openly about the Black beauty industry. Welcome, Astrid. Glad to have you. Oh, we need to unmute Astrid. There we go. Welcome, Astrid.
Thank you. Glad to be here.
Yeah. And then last, but certainly not least, is Isabelle Chaudry. Isabelle Chaudry is a lawyer and human rights advocate. She is the National Women's Health Network's Senior Policy Manager, responsible for developing and leading their women's health and consumer safety policy efforts, with a particular focus on historically marginalized communities. She's taken a lead role in a collaborative campaign against Johnson & Johnson talc-based powders. And we're very proud to say that she's also a board member of Women's Voices for the Earth. Welcome, Isabelle.
Thanks for having me.
Yeah. So I think we're all ready. I think we're all good with all the technicalities. We can hear everybody, so that's great. We have a slate of questions to ask our panelists today, and I'll direct each question to either 1 or 2 panelists first. And then we can open it up to any of the other panelists who want to add their perspective if they like. If anyone in our audience has a question, please feel free to type it into the chat. We'll be monitoring it as we go. And hopefully we may be able to answer the question as we go, or if we have time at the end, we'll get through some of the questions that have come up. So our first question, we will start with Dr. Ami Zota. Our first question is, what is the current science telling us about the harms caused by chemicals in intimate care products?
Thank you, Alex. And just thank you again to all of WVE for hosting this important event. You guys have always, or you all have been leaders in this space for a really long time, both in terms of the science, the public awareness, and driving corporate accountability. So just really want to thank you for that leadership. You and I have been kind of, I've in the science space, I've been working on this for quite a while, trying to kind of drive more attention to this issue because you know quite well that, what we know is just not enough. There has been very little attention to the composition of intimate care products and the impacts they have on our sexual and reproductive organs. The thing that is concerning to me about the chemicals in these products, one, they're highly unregulated. So really, it's hard as a consumer or as a scientist to know what you're exposed to. And the fact that, really we're talking about chronic exposure. If you think about most individuals are using these products for decades, as monthly, sometimes even more frequently than that. So there is really a lot to be concerned about. Some of the chemicals that have been measured in these products include phthalates, some of which are established endocrine disruptors or hormone disruptors associated with reproductive harm, including difficulty in getting pregnant, pregnancy complications like preterm birth. I recently released a paper with a group of phthalate experts, a consensus statement, shining a light on the compelling evidence between phthalate exposures during pregnancy and impacts on child neurodevelopmental harm. And this paper by a group of experts called for the elimination of phthalates in consumer products, especially when they come into contact with vulnerable populations, including pregnant women, children, as well as socially vulnerable populations such as communities of color. Other chemical classes include parabens, volatile organic compounds, which have carcinogenic properties. And then there's lots of chemicals that we just don't really understand, like these fragrance chemicals. They're there. What are they doing to our health? We don't know. What are all these chemicals doing when they're acting as a mixture? We know that these chemicals can have additive synergistic impacts. How they're impacting our microbiome, or, I study gynecologic health, I study fibroids. So, how they impact fibroids, endometriosis. We're just beginning to understand these complex relationships. And so my work has kind of both looked at that in a health disparities, a racial health disparities framework. And we've actually shown how the use of some of these intimate care products like douching is actually in part driving the racial disparities we see in environmental chemical exposures. And I'm sure we're going to get a chance to talk more about kind of this social historical context for, kind of why women are using these products. So I'll just stop there.
That's great. Thank you. Do any of our other panelists want to add anything about chemicals in intimate care products?
Yeah, I'm going to add, thank you, Dr. Zota, for that preview. I don't know if our attendees are aware of this website called ewg.org. It's a great website to verify if your products are safe. And it's important to have that conversation. It's never too late or too early to become aware of like the chemicals you use. When I was in medical school years ago, and when I started as a gynecologist, I thought it was a known knowledge for people that douching is not recommended. But even today, I had to tell a lady douching is not recommended. And I'm glad, thank you, Wave, for having this conversation. So if we're going to have a take home or a call to action is please stop douching. I just don't understand why you started. And I mean, in terms of heterosexual relationships, your vagina doesn't need to smell like flour. Like, why? I don't understand why people think their vagina needs to smell like that. Again, I don't know if you guys mentioned this, but I'm a life coach, so I coach women a lot. And I recommend women to be self-aware, right? Be aware of yourself so that you don't need a man to tell you that your vagina needs to smell like flour for you to be happy. All right, so I know I'm being a little bit tangential, but I think like the core of the problem is trying to please someone else because our vagina is not supposed to smell like flour. So why douche? Thank you.
Thank you, Dr. Azumah. Very, very good points. And I think in the next discussion we'll get into that. I just wanted to also add from Women's Voices perspective, we've looked into a lot of the research specifically on chemical testing of menstrual products that have been out there. We'll put the link chat. We have a timeline of chemical testing. It's really all happened about in the last 7 years, looking at what chemicals have been found in things like tampons and pads and menstrual cups. And there are links to all those different studies. These are, all studies that raise more questions than they give answers. But you can take a look at that if you want. That's in the chat. Any of our other speakers want to, Astrid or Isabelle? Okay. We will move on to the next question. This question is for Dr. Azumah. The harms that intimate care products are causing are completely unnecessary, as the vagina is self-cleaning. Can you explain what it means for the vagina to be self-cleaning? And what are the repercussions of using products like vaginal cleansers, douches, and wipes?
All right. Yes. Thank you. Thank you. Thank you. Very good question. So I heard you say, do I agree, or does the science agree with the fact that the vagina is self-cleaning? Yes, it is. Our body is just amazing. Our vagina, again, I'm a gynecologist. I talk about vaginas all the time. I'm not a pervert. It's just my field, and I love my field. It is self-cleaning because our vagina has good bacteria, lactobacilli, which basically helps to regulate and clean it out on its own. So we don't need any more product. Our vagina is just perfectly made. It has a pH of 3.8 to 4.5. With infection, it changes obviously, but we'll talk about infections later on. But in terms of douching would change that pH and make you more susceptible to infection. So yes, our body was just made perfectly. So we don't need to do much, but just, mildly clean yourself. I mean, it's hard sometimes for us to not use like soaps, but there's safer soap that you can use to wipe. But to be candid, you just need a water to rinse down there if you have to. But yes, our vagina is self-cleaning in a normal situation. However, if you have comorbidities such as diabetes, HIV, or other things that leads to immunosuppression, then your pH might change, and the good bacteria, quote unquote, lactobacilli might go down, so you'll be susceptible to other infections. Thank you.
Okay, terrific. Anybody else want to add to that? Okay. Yeah, I think it's really, really super helpful understanding of kind of the vaginal processes, and something we've always realized how important it is to underscore how little education there is often for girls and women on the science of how vaginas work, and what we know, and sort of a lot of the misinterpretations that are out there in terms of what's needed and what's not needed to care for this part of our bodies. So thank you, Dr. Azumah. Our third question is directed to Isabelle Chaudry and Astrid Williams, and we'll start with Isabelle. The companies that are making intimate care products like douches, wipes, deodorants, powders, and other products, they market their products overwhelmingly to Black and Latinx people, with these folks being the primary users of these products as well. What are your thoughts on this marketing, and why do you think companies are doing this? So we'll start with Isabelle.
Yeah, I think it's predatory and harmful. Certain beauty standards have been shaped over time through racist advertising and commercial marketing to perpetuate false ideas about Black and brown people. And we know that the industry uses the media to influence consumers, so they will bombard Black and brown women with images of women douching and engaging in other practices who look like them. And so myths and stereotypes have been perpetuated to these communities. False ideas about being unclean and having certain odors have been perpetuated, and the industry has always capitalized off of this. So, tapping into Black and brown women's insecurities regarding beauty, and thereby influencing consumer choices. And I think all of this is because the industry is doing this for profit, of course. So those are my thoughts.
Yeah, and just to continue on with that, historically, if we look at the racial injustice, if we want to take it back to, reproductive health in terms of the Tuskegee study that was done with gentlemen in the Tuskegee area of Alabama, and also with Henrietta Lacks in the securing of herself unjustly. And so, you know, she had cervical cancer being treated at Johns Hopkins University. And so the physician, George Otto Gay, who is touted as one of the grandfathers of OBGYN, unbeknownst to her and her family, you know, took these cells. And as we now know, the HeLa cells have come, you know, stem from out of that research that has been used well on, you know, Their Immortal Life, which is also a documentary that I encourage you all to participate in watching. But I mean, that in itself is a great case study of the racial injustice in looking at reproductive health. And so there's very, you know, rich history pertaining to that. So just being mindful and cognizant of your body, you know, body odor or discrimination is something that we face in the African American or Black community. And so, yes, your vagina shouldn't smell like a bed of roses. You know, it should be individual and unique to you.
I'd like to add something, if that's okay. Yeah, so I mean, I think the other way to think about this, or another layer of kind of to add to this conversation, is to really think about kind of systems of power and oppression. And kind of, we know that factors like structural racism and sexism, right, affect health. There's a lot of attention to that. I think in this kind of conversation about consumer products, there's less conversation about how these systems of power and oppression impact our product use and our beauty norms. And a couple of years ago, myself, along with Dr. Bhavna Shamasunder, who's also a colleague of Black Women for Wellness, and Astrid, Dr. Williams, we're all doing a study together. We wrote a piece called The Environmental Injustice of Beauty, which is really trying to kind of, I take an environmental justice framework to kind of understand why certain beauty practices are racialized. And so I think kind of chemical straightening in hair is one among the Black community, among Black women, is one example that I think a lot of people are familiar with, and maybe it kind of intuitively, there's a better understanding of the intuition there. But, you know, in that, we also talked about fragranced intimate care products in this context. And so, you know, we theorize that, like, the greater use of these fragranced intimate care products, whether it's douches, but it's also it's you know, sprays, you know, it's powders, it's the fragranced wipes, right? And even our very recent data, which we just published this week, our Taking Stock study in Silent Spring Institute, GW, Black Women for Wellness, Occidental College, and LA Grit Media, we're still finding these racial ethnic differences in the kind of use of these intimate care products. And, you know, I think there, you know, in one way there's sexism just generally, because I think all women from the time that they're young are just taught that vaginal odors are bad, and, you know, you're supposed to conceal them and not bring attention to them because, you know, that's just that, you know, it's sexism, right? But I think that when it comes to women of color, there is an it's an intersectionality. There's like a multiplicity of racism and sexism. And a lot of it, especially for Black women, goes back to the time of slavery, where scent and odor was used as a way to make, where, you know, white patriarchy was, you know, creating this otherness and, you know, the idea of race to, you know, to oppress Black people. And they used odor as one mechanism of creating these power structures. And so, you know, the kind of the adaptive response to use some of these products, you know, it's almost like an adaptive response to racism over the years and over the, you know, hundreds of years. And so there, you know, there is actually historical writing around this. And I think it's important to think about these social and historical layers, especially as we try to have conversations to change behavior, because now a lot of this has been passed down from generation to generation, between families, between peers, and you know, but, you know, I think there are reasons for this kind of historically. So I think it's important to bring those into our conversations.
And I would agree. It's generational. So within our Black community, it's something that's passed down from an early age when you start puberty, as to make sure that, you know, your intimate care is, you know, fresh and clean. And so it's just something that is innate. So I just think that there needs to be greater awareness and education around these products that are out there, that, you know, you don't need to use them. Your body is going to, you know, cleanse itself naturally, as Dr. Azumah has mentioned.
Yeah, thank you, Dr. Williams. Thank you, Dr. Zota. Thank you, Isabelle, for that. Again, based on the work we do with Love Your Menses, okay, so we try to empower girls through education of menstrual equity and just menstruation. And the amount of thank yous we get, because a lot of Black moms, we focus on brown and Black girls, they don't even know how to start that conversation, you know, because they equate menstruation with sexuality or onset of sex. So the goal of Love Your Menses and what we've been doing is to change that and say, no, menstruation is not about a trigger to start becoming sexually active. It's just to understand your body. And then when we go to the other layer, like you guys have all said, it's just sexism. We've sexualized the woman's body to a point that even women see their body as a sexual symbol. I'm not saying it's not, but there's more to our body than sex. Because even sometimes when we go to places, they're like, are you guys going to be talking about sex? We're like, we're far from sex. We're just talking about the menstrual cycle, what products are good, what is good touch, what is bad touch. It's just so that a girl can understand how her body works, so that she would not use douching products, so that she would not need to, you know, to use chemicals on her hair that can lead her to have precocious puberty. So my point here is the conversation is not being had in families about what is normal. Okay, so I don't even know how people get the information on how douching is right, because they don't even have the normal conversation. And I think in our communities, Black and brown communities, we tend not to. So it's easier for businesses to come in and advertise, right? Because the goal of any business is to make profit. They will capitalize on anything. So it's our duty as professionals in our community, and the work that Dr. Zota is doing is to inform people and let them know you don't need to buy those products from the businesses. Hopefully, when we stop buying it, they'll stop producing, right? It's supply and demand. Thank you.
Yeah, I'd say one of the questions that came up in the chat related to this is talking about the companies making these products and whether they're sort of doing their racist advertising willfully and evilly, or whether it's more ignorant, you know.
Can I just bring up one example?
Yeah.
I mean, yeah. So I mean, right. It's hard. Sometimes it's hard to document what comes first, right? And, you know, I mean, I think it's sometimes complicated feedback loops, but I think one example of just really nefarious, insidious marketing where Black and brown women were preyed upon is with Johnson & Johnson and the whole talc powder issue. And and, you know, now because there's been all these lawsuits, a lot of their internal documents have become publicly available or publicly disclosed, and at least to lawyers. And, you know, two things to point out, right? So talc, when it's naturally mined, is co-occurring with asbestos, which is a known human carcinogen. So first, right, baby powder was mostly used on babies, but then pediatricians were concerned because of inhalation risk of the talc particles and health effects of that. So then they slowly moved away from that, but they had to find a new market. So then they started marketing towards adults for freshness use. And as they faced increasing scientific and medical backlash, because there were these independent reports of asbestos in talc, you know, in the same emails where they're talking about the scientific and medical backlash, so they're recognizing that there's a potential risk, right? And that at least these experts think there's a risk. In those same communications, they discuss increasing marketing to women of color. And so, you know, that is an example where and with tobacco too, right? So as these products become unacceptable to mainstream, audiences who have more power, potentially more education, right? These companies like shift to preying on other populations, right? To continue to make money.
And there lies the racial injustice, the health equity or inequality that exists in our communities.
And I'll just add that federal policy or cosmetic policy does not help the situation either, because it does not protect consumers. So these companies can get away with putting harmful chemicals in their products through loopholes and regulations that allow them to put chemicals and fragrances in these products.
And as Dr. Zota said, the tobacco industry has shifted to third world countries. Like now more people are smoking, and we know it's bad, but they don't want to stop because, again, business people are business people. They think of profit, profit, profit. That's a saying. I did go to Harvard for my public health training degree, and there's a saying that, jokingly, that is it 10% of those that get their masters in business will end up in jail. I mean, you understand what the point is. The point is they're different, like the public health people, the physician, the professionals, people like Isabelle, we're thinking about the long term. We're not thinking about the short term, but those people are made differently, in my opinion. They're thinking about profit. How can I make millions, millions, millions? So it's our duty as community advocate, as WAVE, to educate women, because, I think we all have that idea that the community, the government should protect us, and they try, right, to the best of their ability, but sometimes they fail us, right? Sometimes they fail us, and it is what it is, but we will continue to strive to educate women that you don't need those products. Please stop douching. Please stop using harmful chemicals. I'll hand it back to Alexandra.
And just to add on to that, the loopholes that exist within the safety and the laws that are, current out there. We at Black Women for Wellness have recognized the need for, large companies such as Johnson & Johnson to stop their production here domestically. And as you stated, they have, slowly begun to do that. But there are loopholes that exist because you can still get it on Amazon, still get it at, dollar stores. And we're by and large, our communities of color shop at these, smaller, more accessible economically, financial resources such as Dollar Tree and, the 99-cent store. So they're still available there, and they're existing, globally in terms of manufacturing these talc-based, powders that exist. So I think it's a problem that's still ongoing, that we still need to advocate for change and just, continue to have these discussions around and bring awareness to the issue.
And just to add to that, and Dr. Williams, you can correct me if I'm wrong, but Black Women for Wellness is leading a campaign because Johnson & Johnson, and this is to Dr. Azumah's point too, right? So there was enough pressure that they're saying they're going to phase out talc-based powders in the US, but they refuse to take them off the shelves globally, right?
That is correct, yes.
Right, so it's exactly what, the point you made, Dr. Azumah, that is the other level of injustice. There's injustices within this country, then there's the global playing field too.
Yeah, no, absolutely. It's really just, how they're marketing things they're working with and kind of perpetuating these systems that help them with their profits, but it perpetuates the sexism and racism for sure. I'm going to go on to our next question, and this one is for both Isabelle for Astrid and Dr. Azumah. Following on this theme of racism, Women's Voices of the Earth has been hosting menstruation workshops that are called Our Stories, Our Flow, with different communities online. And we've hosted a couple of them with Love Your Menses this year. And we've been hearing from participants of color, particularly, that they are constantly being invalidated by their gynecologists and other medical professionals. And this can often lead to people self-diagnosing their own vaginal concerns, using intimate care products to self-treat their symptoms because they're not being trusted, by their doctors, by their medical professionals. What are your thoughts on this? What advice would you give to your audience today on what to do about this issue?
I'll let Dr. Azumah go first, and then I'll share my thoughts.
Okay, all right. Thank you, Dr. Williams. I mean, there are studies out there that shows patients of color do better when they see physicians of color. I mean, I can share my own personal experience. I see another person of color as my younger sister. So, I would tell you what I would tell my sister, and there's a kind of trust. However, there's some times that the patients don't trust people of color, right? Some of them prefer another color because they've bought into the racist idea that people of color cannot be physicians, scientists, so they don't trust you. Sometimes we jokingly say when the ice tastes better, like white ice tastes better, white ice, so there's that situation. But in general, majority of people are very appreciative of seeing someone of color and provide care. Because, for example, with hair loss, I think Dr. Williams, you're dealing with with hair loss. I would send a patient, even a patient of non-Black heritage, I send them to a Black dermatologist, because a Black dermatologist knows how to treat hair loss. Like, we've had hair loss programs and I've learned a lot. So it's just, when you're a person of color, you understand, and it's easier to relate. I think there's a psychological term for that, commonality of a kind. It's just easier to relate to them. So I feel most patients would prefer a person of color because they feel like heard. Again, it all stems from racism. Like, you sometimes feel that someone that is not Black will not listen to you, will not validate you, would ask inappropriate question, look at you funny. But when you see someone that looks like you, that implicit biases is lowered, your guard is lowered, so you're more receptive. I'm not saying there's no injustice in medicine, but I'm saying from my experience, patients just feel more comfortable seeing people like me. Like, I do know in situations where patients are giving a certain group a hard time, a person that looks like me, I go in there, it's different. I don't know why, but it's just a different dialogue. It's like, oh my gosh. And then I always tease them. I'm like, why were you giving my staff a hard time? They're like, it's the hormones. I'm like, okay. But but I do know it's just because they saw someone like me. And just to put a plug, that's why we really need to increase the number of minority physicians in medicine. There's a plethora of reasons why there are fewer of us, but we do make a difference for any organizations because we can decrease the risk of complications when patients talk to us. I don't know if I answered it, but I'll go to Dr. Williams and she can take it home.
Yes, I think all of that, to what you have just stated, I agree. And just to continue on, is that more women of color, or just people of color in STEM, science, technology, engineering, mathematics, to go into research, to continue to do the research that will enhance, the field of medicine, and also, the scientific study that we're, all looking here. But it's that relatability factor, I think, when you see the commonalities, the life experiences of someone. And also, I think you'll be more open to disclose some of the things that you're, dealing with, versus if you're talking to someone outside of your ethnic background or race, they don't have that same, cultural, history, or, just the experience of, doing things like, using intimate care wipes, powders and things of that nature, which we, tend to use within our, in our communities. And so it takes someone, from your own, racial, background to say, why are you using that? You don't need to use that. And that relatability sometimes just to talk to you, more of a one-on-one basis. And I think you'll get far further along in those discussions and, opening up the lines of communication when you have someone that looks like you.
Other thoughts from our panel? Those are great responses. And it's certainly something that we've been very concerned about for all women using these products, and particularly, intensified for people of color, I think, is that, people don't like to talk about their vaginal concerns or issues or symptoms because our culture says this is not something you should talk about. It's all the more prevalent when you don't feel like your doctor is going to listen to you. I mean, it's all the more of a problem. And when you're self-treating your symptoms with some of these products, you're like, okay, maybe this will solve my pH problem or whatever, these are actually products that are probably making the problem worse. You know, leading it sort of a downward spiral until it gets so bad that you do have to go to a doctor. Yeah.
Before we move on, I just want to also make a note of it, is that to have this conversation with our partners as well, because I know the focus is on our reproductive health with, women, but also if we really want to, broaden the conversation and get to the root of the problem, is to educate our partners, that our bodies are unique and that we're going to have a unique smell, and also what are their, thoughts in terms of this, because I think they also can have, misconceptions, preconceived notions, within, their gender, background, and they're bringing up. And so is to have open discussions, candid, opportunities to, talk to our partners as well, about this.
Yeah, it's a very good point. I mean, often sort of bemoan the fact that there's so little education for girls, but there's even less education for boys. I mean, and it's so important, so important. I'll go on to our next question. Which is sort of similar along these lines. We at Women's Voices for the Earth, and certainly others who are doing this kind of work, we have pretty strong messaging around telling people that they don't need these products. But that doesn't always fall on receiving ears. Can you share your thoughts on better approaches to education while acknowledging kind of history and cultural norms and maybe family influences? How do you talk to people about these products? And yeah, this is open for anyone on the panel.
Yeah, so having conversations like this, where now we're in our virtual, atmosphere, but I think actually a benefit of it is that you have a greater reach. And so it's not just defined to your geographical location when you're doing things virtually. You can come from, all over, the world to be able to talk and bring people together. But to, have, larger discussions about this, as I mentioned before, we have a campaign with that we're bringing awareness to Johnson & Johnson's, racial injustice with their, talk-based products. And so, most people think of Johnson & Johnson, what do you think of? Baby powder, right? You think of, intimate care, but that is something that most people don't know that they should not be using. And so, bringing awareness, having, small and larger discussions, and to keep the conversation going about this. But again, I think needs to be ongoing, continuous, research surrounding this, because research is what's going to be able to drive, the hard data, because you can't have this talks without having the data to support it.
I can just add on to that. I do a lot of communications work, everything from teaching, so the classroom is a great place. I mean, I think just, it's so interesting. Like, all of you know this, like just bringing up these topics, it really makes people uncomfortable, like everyone, I don't know. It's just like this, it's such an ingrained thing. Like we're going to talk about vaginas or, like, I don't know. And so I think the more you do it and the more you create space for that, that's just the first step. So, right, even when I go into classrooms with graduate students or undergrads, like there's also just this, like, I remember giving, like way back when I was even presenting to nurses at UCSF, and they were so engaged in my research, and then I brought up douching, and man, did the room go quiet. And this is like nurses, right? So it's just interesting. But the other thing I was going to say is using new forms of communication. And so I have been doing this initiative called Agents of Change, where we're working with kind of next generation leaders in environmental justice. So they're all scientists from historically excluded backgrounds. So PhDs, postdocs, really rising stars, and we're kind of giving them new platforms to share their ideas, teaching them how to write for the media, write for the public about these kinds of topics in accessible ways. And we've also started a podcast, which is a really appealing, platform, especially to reach kind of younger folks. It's just a new, different medium. And one thing, so all of our change agents, right? They come from, historically excluded backgrounds. A lot of them are first gen, disabled, immigrants from Black communities. And for so many of them, they're doing this amazing science, but they've rarely been able to share it with their families in a way that would be approachable or accessible. And so a lot of the stuff they're doing with us, they'll make the comment that this is the first thing that they've been able to share with their families, and their families actually understand it. And, it provides a door to more communication. So I think the onus is also on us, people that are steeped in this community, to really be creative and work harder to try new ways of communicating. Because I think we just have this notion that if we have the information and we put it in a fact sheet, that it's gonna reach people. But I mean, it's not, right?
And I love that, to be creative and think outside the box. And if we really want to, be inclusive to adolescents, right, as they begin, puberty, podcasts, and YouTube is, phenomenal ways to be able to, share. There's so many individuals that are getting on there talking about, these conversations, having these discussions, of products that they're using. So those are great ways as well to be able to touch audience that we, haven't thought of, or ways of means of being able to get education out there as well.
To add to what both of you have said, I do believe in persistence and consistency. It could be from my spiritual background, but I do believe that no matter what, just keep telling the message, because someone would listen, and you help the next person coming to be able to be effective in their messaging. So maybe because of WAVE, my patient will come in and say, Dr. Azumah, I read on the WAVE website about the tampons not to use. Is that true? So yes, you might not see the direct impact, but I do believe, like in energy and interconnections, that what work you're doing, it pays. It pays off, and it's going to help the next person. And in terms of a charge, those of us, Love Your Menses was started because we wanted to educate the young girls from a community educator stance, not just from a physician, because we felt like it's very important to engage future leaders. We have 8 years old, 9 years old in our organization that already know about puberty. They know about LH, FSH. They know more things than I did going into my first year of medical school. So it's really, 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 really important that we do our part to just be consistent with our message. And I'm sure we're making a difference. I mean, look at where we are now. We're talking about vagina really in public. 20 years ago, we could not. So we've come a long way. We're not where we need to be, but there's more equity for women, because women now understand who they are. We call ourselves sacred. We are very sacred beings, and we need to be respected. And it's just a beauty. I am an optimist, but I think we're living in a good time now. You will be better, but it's better than 20 years ago.
And with that more confidence, body confidence, you make better choices, better decisions about your body. So I love that you're starting at such a young age to be able to incorporate this information, because when they're that young, they're more receptive to that, to make some of the positive decisions and to share among their peers as well.
I see a lot of comments in the chat about the need to engage men in this conversation, and Dr. Williams brought that point up, I thought, really well. And I think from the science side too, that there's a need for that. So Dr. Shauna Swan, she's a really well-known environmental and reproductive epidemiologist, and she published a book called Countdown. And it just came out, I think, this February, and she's everywhere. She's like, they're talking about it on New York Times. She's on the Joe Rogan show. I mean, she's like making the rounds. But I mean, her book is all about kind of the crisis of reproduction, and it's really focused on men's health and how sperm is being impacted and how that's impacting fertility and the role of chemicals, some of these synthetic chemicals that we've been talking about. And we had her on our podcast actually talking about her book from a reproductive justice perspective. And she said one of the kind of, things she wants to come out of this is to help shift the conversation so that women aren't the only ones who feel responsible if there's fertility problems, and for men to realize their role in that too, in kind of fertility health. And so, she brought up kind of that she hopes that her book will help create that awareness too among, that shift, I would say.
And that's so important because oftentimes when we think about infertility, who do we point the finger at? We point the finger at the woman that, you know, she's the reason why, you know, that they're, you know, having, you know, problems with, you know, reproductive health. So I think there's a equal distribution of that and having, you know, greater conversations about this.
Yeah,
And
and
you
to
know,
what
also in terms of partners, so just thinking, you know, more broad, and so partners can, you know, go for, you know, both sexes, being more inclusive in the discussions that we're having now with our partners, being broad in the scope of thinking about that.
Did you have something else to add, Dr. Azumah?
Yeah, sorry, Dr. Williams, for interrupting. I just wanted to say, whenever a woman comes to me for infertility management, I always say, we need a semen analysis. Like, why? I'm like, we got to make sure your partner is normal. Because like you said, women take that burden a lot. They're like, wow, I didn't think of it. I'm like, 1/3 of infertility is from the man. Let's start with the man first. So you're right, our environment, we have a long way in terms of empowering women to not just blame themselves. Like, we carry so much load. Yes, there's improvement, but we carry so much load. We need to like stop being superwoman and just, ask for help, ask for help. Thank you.
Terrific. And we'll get to our last question. We're almost at time, my goodness. It's been such a fabulous discussion. I so appreciate it. We want to talk a little bit about, again, sort of the products and the chemicals. And this question is both for Isabelle Chaudry and Dr. Williams. What are some ways that folks can get involved in holding corporations accountable? What can the people on this call do to make them accountable for their marketing and for the chemicals they use in their products? I might start with Isabelle.
So one way, or a few ways, one is support the advocacy organizations that are advocating for change and trying to hold these organizations accountable and these corporations accountable. And as a board member, I'd say donate to WVE. Another way is to stay engaged and involved in, all of our advocacy efforts. So I work with Dr. Williams a lot, and we often have social media campaigns where we're spreading awareness about these issues. So the more folks that are involved, whether it's like engaging in our tweet storms or just sharing the content that we put out there, the better. Another way would be to educate yourselves. So we've all touched on this a little bit, but just sharing the information once you do find out, because once you know better, you want to do better, and also share that with your community, with the people that you're closest to and folks. And then I'll also add that we want to stop supporting these corporations. So the reason why they are able to sell these products are because people are still purchasing them. So as much as we can, when we do find out about how harmful these products are, share that information with your peers and your community, but also stop purchasing the products that are harmful, to the best of your ability, of course.
So yes, just to add to that, I think you can be very impactful at the grassroots level in working with, organizations such as Black Women for Wellness and other, nonprofits that are leading the way in terms of advocacy. So just being, cognizant, going to your city council meetings, being able to raise questions about it. I know not something that we're talking about, directly, but it does impact our reproductive health, is the environment where you live. And so we have, partnered with, coalitions such as Change here in South Los Angeles that look at the issues of oil drilling, neighborhood oil drilling, how it has an impact on our reproductive issues. And so looking at how you can be, part of the solution, lending a voice. Oftentimes we're not in these spaces. Environmental health or, reproductive health is thought of, a white problem, if we want to be candid, when we think of infertility, oftentimes we think, oh, well, that's, a white woman's problem. Like you're not going to be able to have, or you're not going to have a problem, having children. If we look historically, Black women have, oftentimes had, multiple children, nursing, being, caring for others, children. So there's just a lot, that's involved with it, historically, and just joining, being, proactive, and being able to have a voice and continue to, advocate for our reproductive health.
And I'll just add that we've got an action alert on our website right now, and we'll put that link again in the chat. You can take the action immediately. We've got an email you can send to several CEOs of intimate care product manufacturers, asking them specifically to take toxic chemicals out of their products, and to stop the harmful marketing that they're doing. So feel free to to take that action and share it with all of your connections and your people. And I also want to just lift up that, everyone who's listening to this, both the panelists and the people listening, all of your voices are incredibly important in terms of impacting companies and what they do. The 1-800 number on a product is an incredibly powerful tool. You can call companies and tell them what you think. They need to know that you care about the chemicals they're using. They need to know that you expect more from them in terms of their marketing, and how, how their products are affecting you. So just reminding folks that voices are very important. And certainly from Women's Voices for the Earth, we can't do our work without the voices of everyone on this call and all of your friends. Let's see, we're pretty much just at time. So that was our last question. I don't know if any of our panelists have kind of final thoughts that you want to add before we sort of close out.
So I just shared our website for Black Women for Wellness. So if you want to continue this discussion and partner with us in our programs, we have the Sisters in Control, as mentioned at the forefront. I'm the Environmental Justice and Reproductive Manager. And so we would love to be able to continue to, have us support us in these efforts. We're based in South Los Angeles, California. However, in a virtual realm, we are able to reach, far and large in a broad community, and also advocating. We were very influential in the Crown Act, as Dr. Zota had mentioned. That is another reason if we're talking about societal norms and being able to change that. So there's a lot of different programs that we offer and opportunities to be able to engage.
Thank you. I'm going to chime in. We talked about different avenues of communicating. We talked about the importance of empowering the adolescents. So I'm here to share good news. Love Your Menses created a program called FlowTech for Girls. The link is right there. So it's a program that was designed for young Black and brown girls to incorporate menstrual education with technology. So we brought someone with the technological background to teach children how to create wireframes, photo voice, and they helped us create an app. So it's called our Flow app. We are launching it in May 28. So if you guys have any suggestions on how to make the program better, please let us know. The link to the FlowTech for Girls website was posted, but please save the date. Help us download the app May 28, Flow Love Your Menses. We're just so excited. And we always love to collaborate with any of you. If you guys want to directly talk to our youths, we tend to interact with them. So we're here. Thank you.
I just also want to say thank you. This was a fantastic webinar. So thank you, WVE, for organizing it, for leading the conversation. And yeah, I do a lot of science in this area, both on the kind of what's in these products, how they affect women's health across the reproductive life course, as well as trying to bring attention to these upstream factors. I'm on Twitter. That's probably the best way to keep track of what I'm doing. I can't even keep track of what I'm all doing right these days. But I did want to also highlight Dr. Williams and I are part of a collaborative that's doing this taking stock study. And we just published a new paper that does include our ongoing study is kind of focused on racial ethnic disparities in a lot of different kinds of product use, including intimate care products. And so I put in a link to the fact sheet from a study we published this week, I think. And then do check out the Agents of Change podcast, because I think these voices are, to me, they give me so much hope, and they are drivers of systemic change, which is really what we need. And where we partner with Environmental Health News, and which is just a great source in general, just for if you want to keep up to date on kind of the state of environment and health in the globe.
And I'll just add, I think this was mentioned before, but there, for folks interested in researching their products, look at the Skin Deep database from the Environmental Working Group. Check out WVE's website, check out our website at nationalwomenshealthnetwork.org. And just please, please, please stay informed about the products that you're using.
Terrific. Well, I really want to thank everyone for joining us today. I want to thank our fantastic panelists, Zota, Ebere Azumah, Isabelle Chaudry, and Astrid Williams, for your contributions, your incredible work, and your insights into this issue. We hope this is really just the beginning of these important conversations. We hope this has inspired many of you. I'm feeling fully inspired from this afternoon and look forward to doing it again. So thank you from Women's Voices for the Earth. Thank you for your support of our work. And I hope you all have a good afternoon. There'll be a follow-up email that will come to you that has links to the actions, that has links to all the organizations from these fabulous women. And thank you very much, and have a great afternoon.
Thank you, everyone.
Thank you.
Thank you so much.
Thanks.